Methamphetamine, an overlooked crisis in this country. In fact, according to the U.S. Drug Enforcement Administration, or the DEA, meth, as it's commonly called, poses a greater threat than opioids in some areas of the country, like the West and Midwest. The DEA also says meth is the drug that most contributes to violent crimes, like homicide and intimate partner violence. Meth also goes by names like speed, ice, crank, and crystal. It's a powerful and highly addictive stimulant that affects the central nervous system. Meth was originally used in nasal decongestants and bronchial inhalers. Stimulants like meth not only open air passageways and constrict blood vessels, making it easier for you to breathe, they also boost adrenaline and raise your heart rate, blood pressure, and body temperature. Meth, like other amphetamines, can decrease a person's appetite while increasing his or her activity level, talkativeness, and sense of pleasure or well-being.
Meth increases powerful chemicals in our brain that make us feel good, which is why it's so powerful and why people can get addicted so quickly. One of the things that happens when our brains overproduce dopamine is we can start experiencing psychotic things like hearing voices, seeing things that aren't there. Oftentimes people will experience paranoia. And we know that with methamphetamine that there is a huge release of dopamine. So oftentimes people will experience psychotic symptoms. And many people who have methamphetamine use disorder end up going to the emergency room. They can be hospitalized for these psychotic experiences. And unfortunately, it's one of the scariest things for my patients who have this disease. Once somebody experiences a psychotic episode after using methamphetamine, their brain is kindled to re-experience a psychotic episode again. So it really is a matter of a threshold that once you cross that threshold, you can't go back. And so if losing your family isn't enough, if losing your job isn't enough, if becoming homeless isn't enough, having your own sanity can become a reason why someone will stop using the substance.
Meth comes in many forms and can be snorted, injected, smoked, or swallowed as a pill. How it's taken affects how fast and long it acts, but no matter how it's taken, it always ends up in the bloodstream and goes to the brain. Smoking or injecting it causes an almost immediate rush that usually lasts 3 to 5 minutes with a long burst of unnatural energy and confidence that can last several hours. Snorting produces a somewhat slower response. Swallowing meth orally doesn't produce an immediate rush since the drug is processed through the digestive system, but it can give users a longer, less intense euphoric feeling that can last 6 to 8 hours or longer. It's not uncommon for meth users to continue boosting the levels of methamphetamine in their system as the effects fade, creating binges that last for days. Meth works by increasing epinephrine, norepinephrine, and dopamine levels in the brain. These natural chemical messengers carry signals between brain cells. They're involved in movement, motivation, and rewarding behaviors. Meth increases the levels of these chemical messengers in the reward center of the brain, causing a desire to repeat the pleasurable experience. Even small amounts of meth can have negative effects, some of them dangerous and even deadly. Short-term effects may include staying awake for long periods of time, decreased appetite, cardiovascular problems such as rapid and irregular heart rate and elevated blood pressure, faster breathing, overdose resulting in hyperthermia, elevated body temperature, and convulsions that, if not treated immediately, can result in death. Meth also has many negative effects for long-term users, including addiction. Over time, those who develop a dependence on meth need to take it more often and in higher doses to get the same high they used to get. This is called tolerance. Studies show that long-term meth use actually changes brain structure and function linked to emotion and memory. In addition, repeated long-term use of meth can cause changes in the brain's dopamine system, and those changes can cause reduced coordination and impaired verbal learning. Changes to the body like extreme weight loss, severe tooth decay and dental problems, sleeping problems, skin infections, increased risk of stroke, and irreversible brain damage can occur. Memory loss can be accompanied by confusion, as well as hallucinations and paranoia, while emotional imbalance can feed into anxiety, violent and aggressive behavior, extreme moodiness, depression, and eventually suicidal thoughts. The risks of both short and long-term meth use are huge, but there's also hope for those who reach out for help, get treatment, and enter recovery. Studies show that with abstinence and time, many of these effects can be reversed or reduced.